This is Average Joe PT, and on this episode, Scully and I, we're going to talk about massage. All the different types of techniques in massage, when you should have one, when you shouldn't have one, what you should actually expect out of a massage. So I want you guys to stick around and stay tuned. Massage is a very, very specialized technique that everybody just goes around rubbing people's neck. Now, sometimes when we talk about the basic massage, which is effleurage, if you can spell that correctly, and petrissage, those two basic techniques are done when you're just gently rubbing the muscles of the spine. And a lot of people will do that along the top of the neck, along the shoulders. People will do that a lot. You get along that shoulder blade area, and they'll go ahead and start to work along that back side, along the upper trapezius muscle group that I'll show you right there. And what happens sometimes is you have these trigger points. We've talked about these in the past, active and passive trigger points that massage can really start to aggravate if you get someone that really doesn't know, like maybe a family member, starts really digging in there, and that might feel good initially, but unfortunately you can start to activate that trigger point, that sore spot, and all of a sudden you start getting pain and headaches that night or the next day. So that's one thing you have to watch out for when even you're doing a basic massage, that you don't have someone tear into your tissue and your muscle too much. So I want you to stick around because I have a lot more information on this different types of massages, so stay tuned. Now, when you're initially going to go see a professional masseuse, you have to really tell them what you want. Because if you get one in there and they just start tearing at your skin saying, hey, I want this, let's say Swedish massage, or I want this massage with stones, you have to be mindful and tell them, hey, I want you to go light this time on me, very, very light. That way you don't get too sore. Because that's what happens with people. They just get in there and they're like, oh yeah, I want a basic massage, and all of a sudden they're really, really hurting. They could even be bruised next time. And that's the last thing you want, is to be bruised after a massage. One big thing that people always just take advantage of is thinking that just because they're a masseuse or professional license that they know what you want. And the reality, just think of it as like if you're getting a haircut. When you get a haircut, the first time you see that beautician or barber, you're going to tell them, hey, this is what I want. This is what my experience I want to leave with. Same thing when you get a massage. You want to make sure that you leave there happy, not crying. So Swedish massage you have to watch out for because they can be over aggressive. Those stone massages, you can watch out for those. Those heated ones, they can get over aggressive very quickly. Now, in a physical therapist realm, what we kind of do with massage is we'll do what's called a cross-friction massage. And that's more of a medical grade massage where we're actually working that tissue. As you can see, when you look at a muscle fiber, sometimes we have to work that tissue hard enough to get the inflammation going again so we can actually get that tissue to heal correctly and lay down the tissue and the cells without getting too detailed correctly. So that is the difference in one point for just a generalized make me feel good massage versus a physical therapy or medical based massage. So I want you guys to stick around. Like always, I have a little bit more that I want you guys to look at, so stay tuned. Is it worth getting a massage? And that is basically a general question that people want to know. Example number one. If you're someone who's really sore, very tense in the neck, they're always holding their stress in their neck area, or they work at a desk all day long at a computer, then yes, absolutely a massage might help you to reduce that stress, bring some blood flow in the area, and get those muscles to relax. Now afterwards, you always want to make sure you drink a lot of water. Staying hydrated is probably one of the most important things that you need to do afterwards that people neglect to do, because all that tissue, all those muscles and tendons and fascia, that's another big one, the myofascia of the tissue, that all has what we call toxins in that area from just being built up from those muscle fibers. And after it's been worked on and blood flow comes in that area, you need a lot of water to flush all those toxins out of that muscle belly and myofascial area, and you'll really notice the difference afterwards if you drink a lot of water. Not just 1 cup. I mean, we're talking 24, 32 ounces of water after having a half an hour to 60-minute massage. Now, when is it not appropriate to have a massage? A lot of these patients that I see who have chronic back pain, when you have a lot of back spasms, or if you just have a lot of really inflamed referral pain coming from maybe the nerves down the spine. You know, when we look at the spine, we'll take a little mini-me here for a second, and all those little nerves coming down that spine, there's also the nerves come out into the muscle fibers themselves. And so when we're working on that tissue, if you naturally have a lot of referral nerve pain, you would not really be appropriate for a massage. It's probably going to get things inflamed even more. You'll probably be more appropriate with maybe some gentle stretching, maybe some heat first, and then maybe finishing up with some ice. That would be more appropriate for that type of person than just a massage. So that's really the positive and the negative of massage. And really the takeaway message is making sure that whatever you do, if it's one of your first times getting a massage, is that if you think you're going light, you make sure you go super light so that your experience is positive. Because you don't want a negative experience, because the reality is you won't go back. And maybe the next time you'll be, the person that's doing the massage on you will be able to go a little bit deeper, because those superficial muscles that I always talk about in the spine, we have a couple different kinds. We have the superficial ones that I talk about, and then we have the deeper muscle layers, and then we have the deep muscle layers that are attached right to the spine themselves. And the first time you get a massage, they're just going to be working those upper areas, and really not being able to go deep until you get that superficial muscle to really relax. And then maybe the next session that you go to, they can go a little bit deeper, and that way you have a positive experience. So if you have any questions for Scully or myself, we'd love to hear them, positive or negative. We'd love to have you join our channel. I try and bring content a couple times a week as much as humanly possible. But until next time, Scully and I like to always say, look up and keep smiling. See you next time, folks.